Hello, everybody. Welcome to How's It Going? I'm your host, Leo Young, and today I want to be talking about how to feel comfortable in your own skin. So, a lot of people might think, it might be like a philosophical thing, but no, we're taking this more literally today, talking about how to take care of your skin, proper skincare routines, and things like that. So, for that, I bring on a very special guest today. He is a Harvard-trained, board-certified dermatologist based in Seattle. Please welcome Dr. Daniel Sugai.
Thanks, Leo. Appreciate it. Thank you so
Definitely.
much. Very nice to virtually meet you and collaborate here.
Yeah.
So real quick, I'm Dr. Daniel Sugai, board-certified dermatologist in Seattle, originally from Hawaii, and been here in Seattle for the last 4 years with my wife, who's also a physician, and I have 2 kids. And yeah, really excited to be on the show today.
Nice. Awesome. Well, thank you for that, Dan. And just real quick before we continue, as with all episodes of How's It Going, what we talk about are for entertainment and informational purposes only. So those of you back home, please talk to the appropriate professionals before making any material decisions.
Exactly. Yeah.
I'm sure you say that too, Daniel. And
Yes.
do you prefer Daniel, Dan?
Yeah, Daniel's fine.
Okay, no problem.
Yeah.
So the burning question, I know in my field, in real estate, in business in general, having a routine is super important. It's just a set of actions that people do to get themselves in the right mindset or things like that. I know for skincare routines, that's something that people like you talk a lot about, people in your field. So would you mind just to, maybe tell us a little bit about the importance of skincare routine and, for men, for women?
Yeah, definitely. Yeah, that's a very good point about skincare routines. A lot of us, especially guys, we're guilty of not having a routine,
Yeah.
and which is universal. I don't want guys to feel bad, but I'm trying to do
Yeah.
is increase awareness for skincare for guys. And you're right. It's like when I talk about skincare, there's no easy quick fix for things like eczema, acne, dry skin. It's all about incorporating a good routine into your lifestyle. And we're all have varying lifestyles. There's hustlers like yourself, there's parents
Mm.
like myself. So the thing is, I always tell patients, it's not a marathon, it's not a sprint, it's a marathon. So
Mm.
doing a consistent regimen will lead to results, just like for finances, investing, right? It's all about the
Mm-hmm.
marathon. So
Yeah.
so in terms of a skincare routine, whether it's a male or a female, young or old, I always talk about morning routines. You want to have a cleanser, a serum. Potentially you could have a serum that's like an extra
Mm-hmm.
bonus, but also incorporate a sunscreen is very important. And I always say for
Mm.
sunscreen, SPF 30 and above. Ingredients, they vary. They're chemical ingredients like oxybenzone, avobenzone, octinoxate, and then there's physical blockers, zinc and titanium. Those are the ones that I recommend for sunscreen. So
Mm.
SPF 30 and above. You could go for water resistant. It'll say it on the box or bottle.
Nice.
So we have broad spectrum. You want to see here, there's broad spectrum. That means it covers UVA and UVB. And, this one does not mention water resistance or this one. Um, but you will see it. I have other examples of what would be like La Roche-Posay and Thelios 50 would say lightweight, not lightweight, sorry, water resistant.
Mm-hmm.
So if you want to go for a run and get sweaty, or if you want to do water play, you want to look for something water resistant. If you're just going to the office, I like Elta MD UV Clear. This is a good one. It
Mm.
has niacinamide in it. It's great for people with acne prone skin. It has niacinamide to calm the inflammation of acne. So this is a nice everyday sunscreen, but not water resistant. So just look at that on the
Mm.
label. So broad spectrum you want, look at the SPF, look and see if it's water resistant. At
Got it.
night, you want to do a cleanser again. You want to wash off all the debris you picked up at work. And then you could put on a retinoid or retinol, and that's a vitamin A
Mm.
cream. And that, I say, sunscreen morning is important, and a retinol for any age, in your 20s, your 30s or more. That's a great medicine to
Mm.
help with anti-aging purposes, reversing some sun damaged skin, helps with acne. So those are my two essentials there.
Okay, awesome,
Yeah.
awesome. And just to for those of you that are not aware, me included, what's the difference between UVA and UVB?
Good question. Yeah, so there are three types of UV rays that come in um, we can be exposed to. UVC
Mm-hmm.
actually we're not really exposed to. It gets filtered out through the ozone. UVA and UVB come through the into the atmosphere, and UVA is a longer wavelength, so it can penetrate even a cloudy day in Seattle. You can still get UVA through the clouds, and that's why we say wear sunscreen even if it's a cloudy day. It also can penetrate window glass. So if you're a driver, truck drivers, left side of the face tends to age faster than the right because UVA will penetrate the window glass from the side. UVB, UV bad, B can cause burns and it can lead to skin cancer. UVA also, but we blame that more for like the wrinkles and sun aging. So UVA aging, UVB burns.
Mm-hmm.
Both
Got
can lead to skin cancer, and that's the big thing. Why that's a big reason of wearing sunscreen is to prevent skin cancer. But the extra bonus is we're preventing wrinkles, brown spots, red spots, white spots from sun damage.
Gotcha, gotcha. And now that you mentioned sunscreen too, so I know I'm kind of guilty of this, just not putting on enough sunscreen.
Yeah,
I know in the past few
right.
years I've tried to put on more, but I think the question is like, when should I put it on? You know,
Good
like
question.
if I'm just going out to grab the mail, or like when I'm driving. I mean, definitely when I go to the beach, but
Right.
you know.
That's an excellent question. You know, that's what a lot of people don't even think about asking that question. They think, oh yeah, if I go to the baseball game or if I'm out at the pool or the beach, I should wear it. But we recommend wearing all year round and every day. Before stepping out of the house, you should have sunscreen on because, you know, window glass, if you're in an office indoors, you're going to be exposed to sunlight in your car. So we say reapply every 1 to 2 hours, especially if you're outdoors. If you're indoors, I'm not as strict about that, but technically you could get some aging from like even the visible light from our light bulbs up on our ceilings in the office. So if you want to be really good, you could reapply. If you wanted to reapply over makeup, did talk about setting powder for females. They could
Mm-hmm.
put a little bit of this mineral sunscreen over makeup while at the office, or if you're at a wedding, you can definitely still maintain your makeup for pictures and protect if it's an outdoor wedding, especially. But again, I think you did mention also like quantity, how much is enough too. That's also very important because a very common problem is that people don't reapply enough. So not reapply every 1 to 2 hours. And they also don't apply enough. So a shot glass amount of sunscreen for your body. And if you want to just cover your face and neck, it's a half teaspoon amount, which is it's a lot of sunscreen actually. I tried doing it the other day with CeraVe's SPF 50 and it's mineral based. It made me very ghost white. It leaves a very noticeable white cast. And I did a TikTok video on it and it was just pretty dramatic. It's a lot of sunscreen. I actually couldn't put all of a half a teaspoon amount on my face and neck. It was getting too caked on. So that's a general rule for sunscreen amount.
Gotcha. So, I mean, now that you mentioned, you know, like it makes your face really white and stuff. So, I mean, is there a way around that? Because I feel like the sunscreen really like weighs you down and blocks your pores and everything.
Yeah, it's a good question. It's a quest of finding an affordable sunscreen with mineral ingredients that doesn't leave you with a white cast, especially for us Asians. You know, we have skin type 3, meaning that we can burn, but rarely, not as much as skin types 1 and 2, which are more fair skin, Caucasian skin. For us, we can tan a little easier. So it's very important to find a good sunscreen. And people always ask, what's an affordable sunscreen? And if I say, you know, if I recommend this, it's affordable, yes, but you're going to be mad at me because you're going to look ghost white, right? So it's a hard call to make. I'm telling people now, if you want a good sunscreen that's mineral based, rubs in well, you're going to have to spend more than $30, like for something like this. La Roche-Posay, Ulta MD, Supergroup, all those are over $30 and they rub in well. They can blur out your pores without causing a white cast or being comedogenic, meaning not acne inducing. And they also have nice ingredients, like this has niacinamide in it. So those extra ingredients help in decreasing inflammation. Or La Roche-Posay has antioxidants, which helps fight the damage from sunlight. So those are nice. So you're paying for not only the blending in, but you also get nice ingredients as well for your face. For your
Right.
body, your arms, you could do, something a little cheaper. To be honest, I just use these for my face, and like the cheaper
Right.
stuff for like my neck and my arms.
Right. Got it.
Yeah.
Now speaking of skincare too, so the other day I had this realization. So I saw this picture of a truck driver, like a career truck driver,
Yes.
and it was like a close up of his face. I don't know if you saw that picture.
Yes.
Left side was like really wrinkly, and like right side is like regular, the skin.
Yeah, no, I'm glad you brought that up. It's like a perfect example of how much UVA does affect patients or people in a car or indoors. You definitely need to be cognizant of UVA coming through, and UVA, we said, is aging. That was a great example. It's gone viral, that image, and I'm glad. I mean, it really does
Yeah.
illustrate how the sun damage can
Yeah.
really affect our skin in a dramatic way
Mhm.
like that, right? It almost seemed like two
Right.
different people, right? So, the aging effects of sunlight, the carcinogenic effects, like causing DNA damage leading to melanoma, basal cell skin cancer, squamous cell carcinoma, those things I
Mhm.
diagnose all the time, even in Seattle.
Wow.
People think, oh yeah, you don't do a lot of skin cancer surgeries. I do quite a bit, and
Wow.
you could also argue that it's also lifestyle. Like a lot of my patients like to go to Arizona, Hawaii, especially Maui. They like to go vacation there and they burn.
Mm.
Then they come back, and then I diagnose these things. So
Right.
yeah, glad you
Yeah.
brought that up.
Yeah, I think just an interesting point too. On like cloudiness, I know in Seattle it probably is like really cloudy all the time. And this sort of reminded me. So back when I worked at Tesla, a lot of people used to ask me this question, when you're talking about solar panels, like, hey, if it's an overcast day, like how do I get these like energy? But
Mhm.
I mean, it's true that like even though it's overcast, like the sun still has its energies, right?
Yes,
Is that
yes,
similar to what
exactly.
you're talking about?
Yeah, exactly. Yeah, it's still penetrating through the clouds and still affecting us. So yeah, exactly. There are
Yeah.
different wavelengths of UV. So the UVA is the one that really penetrates. The longer the wavelength, the deeper it can penetrate things like glass or the clouds.
Mm-hmm.
Yeah.
Gotcha.
Hmm.
Yeah, and just to continue too on that picture, on that viral picture, I
Hmm.
think after seeing that, it sort of woke me up,
Yeah.
and I went and got my car tinted.
Yeah.
So you have a Model 3 as well, right?
Yes, I do. I love it.
Yeah.
I did tint it
Nice.
as well to the legal
Nice.
limit.
What's the
Yeah.
legal limit over there?
I think it was like 26%, I think.
Wow.
Oh gosh,
Okay.
don't quote me on that. I'm just throwing that out there. But
Yeah, yeah, yeah.
it was 1 year ago I did it. As soon as I got the car, I got it tinted, and it's a
Nice.
beautiful car. It's white,
Right.
a multi coat pearl white,
Mhm.
and yeah, it's
What's
a
the
great car.
interior?
Yeah, the black interior. Yeah.
Nice. I
So yeah.
Do you have the all-wheel drive?
Yeah, I got the all-wheel drive long range. It's so fun.
Nice. I have the exact same car as you do.
Nice. Great, 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 great. Oh, that's
Yeah,
awesome. Yeah.
yeah.
I got it wrapped too. Just
Mhm.
not just partially for the front and like the
Yeah.
rocker panels on the side. And yeah,
Mhm.
it's been a great car. Zero issues.
Yeah,
Yeah.
that's great. I mean, just on that too, like, so I was really hesitant to get my car tinted. I got mine
Mm,
like a year and a half ago.
mm,
I was just like, I mean, I don't really care how it looks. But then after seeing that picture and doing some more research, I'm like, okay, the tint in your car window, it's an investment for your skin because
yeah.
it protects a lot of the UV rays. I know like I'm guilty all the time of not applying enough sunscreen. So like
Yeah.
this sort of helps me, right?
Yeah, yeah, exactly. Yeah, and especially for my kids sitting in the back, they're restrained in a car seat and they're just getting blasted by sun the entire
Right.
ride. So it
Yeah.
makes me feel better that that they're protected to some degree. There's still UV rays that do penetrate with tinted glass, but it does get filtered out
Hmm.
because of the tint. But it does make me feel better, especially since kids don't keep sunglasses on all the time, and we
Right.
don't always remember to put sunscreen on them before a ride, right? So yeah,
Mm,
exactly what you said.
definitely.
Hmm.
And now also speaking of younger people, I know there's
Yeah.
a lot of younger viewers here.
Hmm.
Can you just talk a little bit about like acne and like how to care for it, like
Yeah.
sunscreen wise, skincare wise?
Exactly. Yeah. So I can do a general overview of acne. And like you said, Leo, that this doesn't replace a visit to a doctor's
Of
office.
course, of course.
And it's just more like skincare education, not true advice. So just a little disclaimer
Yeah.
there. But
Mhm.
yeah, exactly about acne is very important because I see young patients in their teens, but also in their 20s, 30s, and even older. So the myth of saying it's a young person disease is not true. We see it in adults. We see it in women with hormonal acne into their 30s or more. So it
Mhm.
can be a chronic skin issue. It's been shown to be associated with depression and anxiety at higher rates. So it's a very important thing to address, especially since if it gets set in with scarring, the scarring is most likely permanent if it's really deep and diffuse, and it can be really red, really brown. It can change the texture of the skin to the point where it's almost disfiguring. Asians, I do see keloidal scarring, so we have a more of a tendency to make scarring, like African Americans also, and
Mhm.
Hispanics. So we have to treat body acne very seriously too, because we don't want to have these large, hard, nodular scars on the body. So it's a very
Mhm.
important disease to get on quickly if you are having scarring acne or acne that's just not well controlled by over-the-counter stuff. You've got to go see a dermatologist quickly. And so the first thing we talk about would be a good cleanser. And I know one cleanser can't fit all sizes, and so benzoyl peroxide, salicylic acid are always good starts. But some people have insensitivities to them. So or they're not sorry, they're sensitive. They have sensitivities to it,
Right.
not insensitive. So they have hypersensitivities to them,
Mhm.
those things. So be careful with those. But those are always nice things to help exfoliate the skin gently. I wouldn't go ahead and do like those mechanical brushes when you have acne because it could traumatize the skin further, introduce bacteria further into the skin. And the salicylic acid, beta, and benzoyl peroxide, those are nice as a chemical exfoliant to clean the skin, kill the bacteria, clean out your pores. So that's always a good start. There's an over-the-counter retinoid. I'm going back to retinoids because I love it so much, but
Mhm.
different gel is a nice start. And that's a over-the-counter strength retinoid that you could do at bedtime. And it's a pea-sized amount to your entire face. Don't do it in the daytime because daylight, like we talk about UV a lot, that will
Right.
deactivate retinoids. So that's a bedtime only medication. So that's kind of a general rule of where you want to go at. There's people with
Mhm.
oily skin or combination skin. People with oily skin, the myth could be don't have to moisturize, but you actually
Mhm.
still have to moisturize. Have a moisturizer in your routine for patients with combination skin with dry and oily, because um, if you have you wash your face and you deplete all the oils that are there without a moisturizer, your oil glands will just pump up more sebum and it's going to
Mhm.
clog your pores more. So you're going to have more acne. So
Right.
it's a little counterintuitive there.
Interesting, huh?
Yeah.
So I think that that's great that we touched on that too. So I mean, with that being touched on, I think we touched on some important topics. Just skincare routine.
Hmm.
Like summer precautions and acne as well.
Yeah. Yeah.
And of course, like those of you back home, if you are curious to learn more, if you want to get in touch with Dr. Daniel,
Hmm.
I'll put all his social media and his
Thank you.
contact links below. So make sure to reach out to him. He's an amazing guy.
Thanks.
Um, and sort of transitioning on to what are some other like common questions that you get?
Yeah. You know, I get questions about, well, first of all, people ask a lot, why dermatology? I just a quick personal question.
Hmm.
Dermatology is a great field, big variety of cases I see. I see 30 plus patients a day, which is great for me. When I was
Hmm.
in medical school in Hawaii, I'm originally from Hawaii and I did
Beautiful.
medical school there, met my wife there. I was thinking about plastic surgery. I liked visual because I was an art minor in college, and I liked, aesthetics.
Hmm.
But I really love the detective work of being a dermatologist, just diagnosing skin rashes and diseases just by looking and not looking so much at lab values. And I also
Hmm.
like working with my hands and doing procedures, so biopsies, Botox, fillers, doing skin surgeries. I love that. So That's my quick answer. And I was very fortunate to do my training in your neck of
Yeah,
the woods. I definitely miss
Harvard.
New England at Harvard. Yeah, Harvard was great. So I was very fortunate to work at do my residency training at Mass General and Brigham and Beth Israel and Boston Children's. So, it's I love my job. It's really great connecting with patients. So that's a very common question my patients ask me.
Mhm,
Other things, people ask about would be probably, like just during this time would be mask-induced acne or skin
mhm,
irritation. So that's the hot topic right now. And my YouTube video that I did, has near 10,000 views in just a couple months since releasing
mhm,
it. It's really well received. And I originally released that video to help our healthcare workers that are out there with the really tight N95 masks
mhm.
and is traumatizing the face where it's causing bruising, really bad indents. So I kind of outline that. So people who are having mask-induced acne, I
Yep.
break it up into either having oily skin with acne or dry irritation. So there's those two baskets, and I try to, I'm going to make
Mhm.
a follow-up video and
Right.
addressing both. And but I
Mhm.
would always say like a gentle cleanser, like Cetaphil is a great start.
Yep.
Neutrogena Hydro Boost cleansing lotion is a nice start, just to soothe the skin. After a long shift, just washing off the debris, and then you could apply some Aquaphor Vaseline onto the areas that are traumatized. That's for like the dry, irritated skin. For the oily skin, you could consider a benzoyl peroxide wash. I like CeraVe 4% benzoyl peroxide cleanser. I do that at the end of the day when I'm very oily, wearing a mask all day. So that's a really nice start. But for people who don't have or who have sensitivities to benzoyl peroxide, maybe just stick with a gentle cleanser. You could consider a retinoid for any acne, that like a over-the-counter option. If you are
Mhm,
pregnant or nursing, though, do not take any retinoids. That's another disclaimer there. But
mhm.
that's, I'm going to probably systematically break those apart the more we start to understand this, because we're seeing it
Right.
quite a bit during
Mhm,
this time. So that's another hot topic right now.
mhm.
Um, and just dry hands, now the weather is better, but just a few months
Right.
ago, we're all having dry hands from washing our hands, which is great.
True.
Great practice, 20 seconds of washing your hands.
Mhm,
Uh, so, dry skincare, you want to have I like Eucerin Roughness Relief for dry, cracked hands or feet. And that's a
mhm.
really nice cream to rub into your hands without leaving a residue.
Okay.
So that's a good start for that. If you're having dry skin on your body, like eczema, I do like Eucerin's intensive repair cream for the body after a shower. So,
Mhm,
skincare for people with dry skin, you want to avoid harsh soaps, hot water, prolonged showers more than 10 minutes, and you want to lather up and lock in that moisture after a shower.
gotcha.
Mhm.
Awesome, awesome.
Yeah.
And in terms of like, any misconceptions or like common mistakes you see that you're like, no, 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 don't do that. Do this.
Yeah, exactly. Yeah, I mean, people talk about, oh, I want a base tan. Base tans
Yeah.
aren't effective in protecting you. It's just adding
Mhm,
more damage to your skin. And so, if you have pigmented skin, if you're very darkly complected, it's only an SPF 4, so it's not a lot. We want SPF 30 to
mhm,
protect you. So having a base tan is pretty weak sauce, right? So
mhm,
you don't want to do that. I tell patients, when you have a tan, it's your skin's way of saying, help me, I am hurt, I'm in pain. This is not
mhm.
good for your skin. So a tan is not a sign of health.
Right.
People have a misconception that when I'm tan, I look healthy. Um,
Mm,
the other thing is people get really impatient with acne and they want to pop things. And I even
mhm.
got on YouTube, some people asking, when is it appropriate to pop a pimple? And I can't answer that because we have to see you. And,
Yeah.
there's Dr. Pimple Popper out there who does great work.
Mhm,
But, we are trained to know when it's safe to actually extract a cystic lesion
mhm.
or inject with some Kenalog. We'll make that decision. And I can't tell people to do that. And just it's just more of the people get impatient. I totally understand. And then they start buying all this stuff at the grocery store or the supermarket, and they just start layering all this stuff on, and they get another rash on top of it. They come in with
Mm,
this bad contact dermatitis from putting too many
right.
products on. So that's another mistake.
Gotcha.
Another mistake is I talked about today on Myth Bust is that people love
Mhm,
Neosporin for cuts, but it's a great
mhm,
antibiotic to clean your wound, but to use it over and over and over again, we do see people get allergic to it. So, and that can be dangerous because it might mimic an infection when it's not. It's just an allergic reaction to Neosporin. So Neosporin has neomycin in it, and it has up to a 9% prevalence rate of allergic contact dermatitis.
Wow.
Which is bad, because I've seen people in the hospital who
Yeah.
get hospitalized and they're getting IV antibiotics for weeks, and they're trying to treat this wound that they think is infected, but all along they keep putting Neosporin on it, and it just keeps the rash going. So I usually say Vaseline, Aquaphor is great to put on a cut. I know people say they are allergic to those things like petrolatum. There's lanolin in those things. So if you are allergic to those things, see your dermatologist, talk about other options for a wound.
Yeah, definitely. Wow. I mean, I had no idea.
Yeah, that TikTok video had 13,000 likes. I put it up
Nice.
on telling people about how, hydrogen peroxide can kill your tissue, and don't use that a lot for a wound. You can initially disinfect a wound with hydrogen peroxide, but it will kill the tissue and slow down wound healing. And I talk about Neosporin as well, and it's well received. But there are some people who still swear by Neosporin, which is fine. I mean, it's a great antibiotic. It's a neomycin's aminoglycoside antibiotic that works well.
Yeah. I mean, these are things that you wouldn't even think about.
Yeah, exactly. Yeah.
And I think it's great that we're covering these things too. I mean, definitely take a look at, Dr. Daniel's TikTok. It's the thing nowadays. And, with what's going on right now, I think there is a hope it's not getting taken down. So that's good.
Yeah, right. Yeah, we'll see if Microsoft buys it. Yeah.
Yeah, exactly. So with that being said, we're sort of running out of time today.
Sure.
Was there anything that I missed out on that you wanted to add?
No, I think that we covered a good amount. I just want to thank you for having me and connecting. Really appreciate this. I know this time we're not really seeing people in person. The annual meetings for dermatology definitely on hold, and it's really nice just meeting people virtually like this, and it might be the new norm for a while. But I appreciate you, Leo. It's been I do miss Boston, so especially the fall, best time of the year. Miss those lobster rolls.
Yeah, come visit.
Yeah, definitely, for sure. My son was born at BI, so it's a special place for us, for sure. So we'll definitely be we'll be visiting.
Yeah,
on a regular basis when it's safe to do so.
Yeah. And so let's wrap up with a fun question.
Oh, okay.
What's one thing that you can't live without?
Oh, besides sunscreen and retinoids.
Exactly.
Yeah. My phone right now has been something really important. It's not good to have my phone on me in front of my kids, but that's been really important. Being from Hawaii, I do love Spam, and I know a lot of people would judge me on that because some people think it's gross, but it's part of our culture. So when I'm at home, I almost need to feel comfortable or secure. You always need certain foods that at home well stocked, even though you have tons of cans or packages of them. I like instant noodles and Spam. That's my comfort food. Not all the time, obviously, lots of sodium and nitrates and such, but it's a nice thing to have on hand when you just need some good old comfort food, especially since we can't travel to Hawaii right now. That's a little thing about me. My medical assistant staff think it's really gross that I like it, but it's people from Hawaii, we all embrace it and we love it, so it's part of our culture. But skincare things: sunscreen, retinoids, Aquaphor, Vaseline. We talked about Vaseline. Greatest thing ever. Great for diaper rashes. You have irritation around your nose or lips in the cold New England winter, or from mass irritation. It's just a great go-to overall, ointment to have. Cuts we talked about. Good stuff.
Awesome. And I mean, speaking of comfort, so that was it. And this is how you feel comfortable in your own skin. I hope you all back at home learned something useful today. If you did, drop this video a like. Take a look at Dr. Daniel Sugai's pages. He's got a bunch of useful stuff. And thank you so much for having me or coming on to the show.
Yeah, thanks for having me.
And to you back home, thank you for tuning in. I will see you all next time.
Be safe, everyone. Peace.
See ya.